Hello everyone, and welcome to another episode of Everything Central Coast. As you can see, yes, I'm in the outdoors. My favorite place to be is the outdoors. I'm here near Pismo Beach Hotel. Of course, Harry's is right around the corner, who are our sponsors. And today our special guest, who is not quite here yet because of traffic in Pismo Beach, of course, is Dr. Nooristani. So once he gets here, we'll get him all settled in, and I'll be able to introduce and talk to you a little bit more about what he represents, what he's kind of done for me. But just to kind of give you a little bit of a backstory, I met Dr. Nooristani well before I ended up getting sick. I met him, it's probably been a little over a year ago, as a matter of fact. And I consider him just one other blessing that I had throughout the journey that I went through once I got really sick. He, as a matter of fact, ended up working at the hospital that I was in. And so he would come in and check on me on occasion. He even went to bat for me on a couple of issues that I had there at the hospital, and helped me feel a lot more comfortable the second time that I was there at the hospital. So we have that connection outside of the fact that I've been working with him on some product lines and just various things and projects. But he's been a wealth of knowledge and information for me. He's a great go-to person for me, especially considering everything I'm still going through and kind of getting back on my feet. So as you all know, health is my number one priority now. It should have been a long time ago, and I think we consider, eating healthy on occasion. We're taking our vitamins and we're doing these things that we believe. I'm trying to navigate the doctor this way.
I got him.
We're working on things that we believe are helping our bodies, but all the while, are we necessarily paying attention to the things we need to be paying close attention to, like going in for our checkups? If our body is telling us something, are we really paying close enough attention to be seen? But with that said, I have Dr. Nooristani coming into the shot, and like I said, I was talking about how we met and how you kind of helped me through, being in the hospital, and the fact that you worked there, and that was helpful. And it's nice when you have a doctor kind of at your disposal that you can message at any time, and I probably bug him sometimes. But nevertheless, like I said, he's been a blessing to me. So I'm grateful to have him here today to join me and my friends and followers, because I know I've talked about the doctor quite a bit. And so now you get to actually meet Dr. Nooristani. So we'll start with you,
Okay.
talking a little bit about how long you've been practicing, and about your clinics, of course. And we'll just kick it off that way, and then we'll go into some Q&A. And just to remind you all, questions are more than welcome. And if we're not able to answer them here today in the feed, then we'll make sure we go back and we answer those questions for you. Obviously, I'm not a doctor, but Dr. Nooristani will help me answer those questions. But yes, feel free to ask any questions. He's internal medicine. So take it away.
Well, thank you. I do apologize for being late. Got stuck in traffic.
You were just in time.
Just in time.
Yes.
Perfect. So hello, everybody. Thank you for having me.
Absolutely.
It's been, let me just move this, see? Always working.
Always working.
It's just been, I've enjoyed Central Coast for the last 15 years or so. It's a blessing to be here.
Talk louder than normal too.
I practice medicine. I started in Sierra Vista French Hospital, Dignity Hospital, so I'm a hospitalist by trade, and now I'm doing critical care and hospital medicine in Lompoc Valley.
Okay.
So I've been here for a while. I just feel like I'm local.
You are local, not
local.
local.
Feel like
local.
a
little local,
a little
maybe.
bit local and a little bit local.
And so, but the big thing that I want everybody to know about, and I know when I first met you, I didn't even know probably for a little while, but if you're familiar with Slow Noor Foundation, Dr. Nooristani is the founder, Noor. But again, I didn't even know that, I think, until I knew you for a few months. I didn't connect the dots. So tell us about founding that and what you've recently opened up, because you opened another foundation out of Lompoc, right?
Correct. So Slow Noor Foundation, when we started working here, and I saw a lot of people who are uninsured and nowhere to go. So we thought about it. What can we do to help people?
Right.
And so that idea 10 years ago
Right.
came to me, and I said I want to do something for the community in general. At that
Amazing.
time, I was doing some project overseas, so I stopped that and embark in this journey,
Wow.
and not knowing how complicated the system is. But nonetheless, we opened the door, and
Nice.
since then we have transformed thousands of people's life, and we have given over $45 million worth of free care
Wow.
and counting. So it's been just a blessing to serve people, and
Right.
as I said, the feeling is just so different because the people you're serving is just the most needy
Right.
people. I mean, they have nowhere else to go when it comes to help.
And so the Noor Foundation, and they're still there in San Luis Obispo. And so I've had a few people ask me, okay, well, what kind of services do you provide, and are there limitations? And so can you speak a little bit to that?
Yeah, so Noor Foundation is for anybody who has no insurance. Anybody
Okay.
who have no
So
insurance
no
can go.
insurance, okay.
That's it. That's the only criteria.
That's it.
After that, I mean, you can get care. It's a preventive medicine, which includes pretty much all your, like when you go to your family physician,
Okay.
primary care physician.
Uh-huh.
So, and also we have subspecialties.
Okay.
So over the years, we have grown that process
Because you
of
guys do
helping.
eye, right?
Correct. So besides subspecialty, so we have eye or vision clinic.
Right.
We have also dental.
Okay.
So it's and also we give free medication,
Okay.
lab workup, etc.
Okay.
So it's an extremely comprehensive.
Right.
It's evolved to being an extremely comprehensive system, and it's the only one of its kind, literally in U.S. because
Wow.
it covers so
The
many
only one
aspects.
of its kind. That's amazing.
Because we have all the subspecialties that's
Right.
part of it. And it doesn't. So the beauty of it is that we have a lot of volunteer physicians that donate their time.
I was just going to ask about that.
Yeah, so I mean, it's just
Amazing.
run mainly by volunteer as far as physician
Right.
concerned. So over the years, as I said, we have subspecialty like neurology, nephrology. We have
Okay.
physical therapy. You have cardiology, gastroenterology. I mean, neurology. We have added so many
Wow.
pieces. And mental health is so big.
Absolutely.
We know that
It
it's
really
such a
is.
deficit. We have added mental health.
Okay.
So we have done a
Amazing.
tremendous work around, and I mean, but it talks to
Amazing.
you about volume, about the community that we are living in. They want to be part of it.
Right.
They want to help their neighbors. They want to help their friends and loved ones.
Right. And then you've had a substantial amount of donors that have helped with keeping the funding going and helping and continuing that. So, thank you to you that kind of started everything, and to all the physicians out there that are continuing to volunteer their time, and all the volunteers there.
Absolutely. I think we have, I mean, obviously it's run by donation and grants, and the door will not be open, or we couldn't do as extensive services if it wasn't for grants or donors. We always laugh at our meetings is that the more patient we see, the business is so good.
Right.
But that's the opposite effect for us because we spend so much money taking care of patients.
Wow.
So the more people we see, the more money we spend.
Right.
As opposed to business
more
model,
money
the
you
more
need, right.
patient you see, the more money you gotta
Well,
make.
being a nonprofit, that's kind of, I
That's
guess,
kind of
the
yeah.
way it works. but-
Well, not in purely non-for-profit.
Uh-huh.
A lot of non-profit also charges you money. So it's
True.
not in a essence is this really purely not non-for-profit, right? Like we got Dignity Health, for example,
Right.
or Common Spirit. They're non-for-profit branch. Yes, they do deliver help, but also they charge you money when you walk into the door. It's
True.
not free.
Yeah.
So ours is just completely free.
Wow.
for
Completely
patients.
free. So if you're out there, you're watching this, or you know somebody that's going through any kind of health issue, and they don't have insurance, this is a great place that you can go to. There's no requirement. You just need to not have insurance. So I'm sure there's some of you out there, or you know somebody out there. And then outside of that, like you weren't busy enough before, so then you decided to open a location, which is called,
Savvy Health.
okay,
So we once I start working in Lompoc, obviously you see the same scenario,
yeah.
same issues, a lack of a healthcare system in the community. So knowing that what it takes to develop, create another one and helping
Right.
people. So that was exciting for me. It was challenging.
Absolutely.
I had to be inspired by my little one, 4-year-old.
Aw.
Slovakia, hence the name
princess.
Savvy the princess, right? She has daddy wrapped around her finger.
Yes, she should.
So yeah, she does. Trust me, she does. So I just kind of want to do the same thing. Unfortunately, obviously, the Slow North Foundation focuses toward helping the community, the county of
Right.
San Luis Obispo. So I had to restart the process again from
course.
scratch and
And
create
Lompoc.
another
Well, and you're in
nonprofit.
Santa Barbara County.
In
so
Santa Barbara County.
Totally
But it was
different.
great. That was great. I mean, the doors opened a little bit over a month ago,
Right.
and we're already so busy. I
Are
mean, the
you?
waiting period is already extended to 4 months. and
Really?
we just
Oh my
opened the door.
goodness. Now, how many physicians do you have there working, and is it a regular basis or?
Yeah, so I think right now with everything else, we start a little slow to just see what the needs are, and based on the need, you expand.
Okay.
So we are open Friday and Saturday, and it looks like pretty soon we're gonna be open at least 4 days a week, and then
4
six
days.
down the road it's gonna be 6 days.
Wow.
It's just there's a lot of people.
Right.
There's a lot of.
I'm sure.
The needs are just it's crazy what the needs are. I
Overwhelming,
mean,
yeah.
I was there last weekend, and
Wow.
I've seen patients that hadn't had anywhere to go for 15 years. I hadn't seen a physician for 5 years. I haven't taken
Oh
their
my
medication.
gosh.
I mean, high blood pressure, diabetes, you name it. I mean, just comes through the
Awful.
door.
Yeah.
So it's awful, but but it's also obviously a blessing, and that
Right.
shows the need, but also the project important.
Absolutely, absolutely, and good for you for continuing that project. And I want to encourage anyone, if you have any questions for the doctor, now would be the time to ask. I am monitoring the feed on Facebook, but again, if we don't get to your question today, we will down the road here. So one of the things, and I'm sure anybody watching, you dealt with and had to work during COVID, and so and I don't think for myself I even really understood the capacity and how extreme that environment was until I was hospitalized, and then I got to see firsthand a lot of, I guess, chaos and just everybody being overwhelmed, and just so. Can you talk a little bit about what that experience was like for you?
So I think one of the things that people don't realize, that they think you're a physician, you're like made of rock. So I mean, like nothing's gonna touch you emotionally.
Right.
And it was extremely hard. It was so hard to go in every day knowing that there's a good chance that you're gonna catch it, because you're dealing with patients
Right.
from the day till nighttime. And at that time I worked at Lompoc, and I do critical care. So you are with vented patients who are extremely sick and they're dying. So the amount of fear that you go in with, because it's just going like to a battlefield. You're like,
Right.
okay, there's a good chance. And at the beginning that we didn't have a good understanding of disease and
Right.
the disease process, so it was unknown. So it's just the fear of itself is just so. I mean, it takes so much out of you.
unknown, yeah.
But then you start losing people. I mean, people die in the hospital usually at old age, and once in a while you see young people die. You get time to decompress and emotionally deal with
Right.
it and overcome it. But now it's constant, non-stop, one after another.
Oh
It just,
my
I
God.
lost more patients in 2 years than I lost 15 years combined.
Gosh.
So that process was extremely overpowering.
Yeah.
Extremely emotional, and you have family. We have our
Right.
own family, so every time you go in, you come back, and you're afraid that did you catch it? Now you're gonna
Take it
expose
to
your
your
loved
family,
one,
yeah.
because I mean, for a lot of physicians, for the
Wow.
first 6 months, they never came home.
I heard.
They
yeah,
stayed in the
I heard that.
hospital. They stayed in the hotels. They went in, and
Mm.
even for me, I mean, I commute back and forth,
Right.
but I used to take shower there, change clothes,
Right.
and come back. So this is an ongoing, everyday process. And then your friends and colleague gets sick, and then you have to cover for them. So I mean, it's extremely taxing.
Well,
in
and then
so
not
many
to
ways.
mention, you guys, the number of hours you guys were probably working had to be insane, because it seems like through all of this, being shorthanded has been a constant. And then I know when I was, in the hospital, then the nurses or the caretakers were getting sick. and then other people had to come in and cover, and it was just this like, that was just toward the end, the beginning of this year, let alone what was happening in 2020 or in the beginning of 21.
It was really sad because the hospitals got full very fast, especially at the beginning, because I think the first wave in this county, in Santa Barbara County, was Lompoc. So just the fear of not understanding what it was going on, that by itself caused a lot of chaos. Usually I go into the patient's room, I wear a gloves, maybe a mask, but now you have to gown up.
Oh, it's the full. I've seen the full. I've seen doctors when I was in there that would they would come into my room and it was like a relief to them, because they'd take off their mask and you could just see the sweat dripping off of them, and it's like, oh my gosh, and we're out there complaining about wearing a mask, and it's like, that's the reality.
Every time you go from room to room, you have to change.
I know.
So on that process of just physical process of just changing from this to this, every room, and it just becomes so exhausting physically. So,
oh my gosh.
It was just absolutely crazy, mentally and physically, emotionally.
Just the strain of just everything.
But just I'm glad. I just said sometimes I looked up in ICU, and I've never seen in my life that many drips, that many medication, going into one person. It's just the whole, you have to bring experience. It's just like from a horror movie. Knowing that you can, 90% of the chances that you're not going to save that patient, that was even worse feeling for a physician, because your job is to save life, not to lose life. It's not, so you have that feeling, but I'm glad that's over.
The worst is definitely over.
But it's not ending, right?
Yeah.
But I don't see in the last 3-4 months, I haven't lost anybody from COVID, so that's great news. Yay. And then so hopefully it continues with the new strain and slowly picking up. But I hope, I wish that.
I know, and it's like, I know, it's just unreal that we had to deal with any of this. Like, that we can, look back years from now and say that, when this time happened, obviously we're never, ever, ever, I'll never forget, obviously, from after what I went through, and it's just the physicians and the nurses and just all the front line and what they had to deal with and endure during this time. So, yeah, I would imagine nobody can thank any of you enough for everything that you guys have done and the lives that you did save. I'm one of them. And when you're in there, though, it's you just got to keep that balance. And it even took me some time to, I think I'm the most important life, right? And there's so many others in there at the time, but when you see the doctors and the nurses like scrambling and trying to to see everybody, and it was a lot of stress and a lot of pressure because of being shorthanded. So like I said, I have a whole new appreciation for those of you that are in there doing the work and saving our lives. So yeah, it was great to have you there. Like, I probably don't remember all the times you even came to see me, because I was probably out of it half the time. But yeah, it was nice having and knowing that you were there, though.
I think a lot of people, obviously everybody has belief system on what they want to put in their body or not. But the transition happened, the change happened after vaccination.
Right.
For old people. Right. You could see a dramatic shift in people not coming to the hospital and dying, older people.
Right.
The people from nursing home, assisted living facility. Yeah. That was such a drastic change from where we started and where, kind of how fast it went down.
Wow.
And then phase 2 of it was just all younger people. And that, the thing that phase was even harder because you're losing people. I have lost families, not just a individual, a whole family. 25-year-old, 36-year-old, 40, 42, 45, 25.
Well, and I've heard it's been, because I was saying, we think we're taking care of our bodies and we're doing all the things we should be, but really, when you put it in perspective, are we doing all the things that we should be doing to protect our immune systems and paying attention to our bodies? And I've heard that there have been super healthy people that COVID basically took out. I mean, people that were taking care of their bodies, that were working out, and because of course I go back and I'm like, well, had I taken more vitamins or had I worked out more, you know what I mean? It's like you go through all these things in your head, like what could I have done better to not be put in that situation, outside of getting the vaccine, of course. But those are the hard realities of after you suffer and go through what you go through, what makes the difference is how you're going to change going forward, right? So I'm going to pay closer attention, and I encourage everybody out there to pay closer attention to their bodies and to treat your body. I mean, it's the only one you have, right? Like health is everything. And talk a little bit about, because some of the conversations that we have, a lot of it has to do with, and I when I talk to people, I say, our bodies are acidic. I don't care, like the majority of our bodies are acidic, whether we're eating a lot of sugars, we're drinking the soda, like we're indulging in those what we consider to be great things, but ultimately they are acid in our bodies. And so pH is a factor in balancing and whatnot. So, but I feel like not everybody understands fully what pH is and what it does. So if you can explain that.
Okay. Yeah, I think pH is a very complicated topic.
It is.
For everybody, including practitioners, because we're really haven't dove into
Right.
the underlying issues that causes multitude of disease process. We just never understood it. Medically, we wait for things to happen and we take care of them, right? Somebody has a heart attack, we're going to give him medication, take him to operating room, put the stents, and bring the pressure down. It's all after the fact. Is before the fact. So part of it is just culturally and how things are marketed and how we receive as a consumer and what is good and what is bad.
Right.
Today I was just giving a talk about, we had a segment on different type of diets. So you Google different type of diet, and there's tons of them.
I was going to say, there's a million diets, right?
Different diets. You got the intermittent fasting, the Mediterranean diet, the ketogenic diet, and here's a dessert with breakfast diet.
Oh, wow.
I was like, that must be the best. Like, wow, I got to be on that diet. You got the vegan diet, the carnivore diet, you got a paleo diet. I mean, the list goes on.
Right.
So which one you want to pick?
Right.
I mean, how would you decipher what is the right one for you if you're doing that? It's overwhelming. I mean, you just look at just those titles are overwhelming, let alone digesting those different type of diets,
right,
and what it does. Some of them have science behind it, some of them just is a fashion, a fad. Somebody comes in, an influencer pushing it, and everybody's doing
thing, right?
It's the next thing. So it's really hard to stay healthy, and so everybody has to have an understanding of really what is it to eat healthy. What does that really mean? What do I avoid? What I don't? And then think about, as I said, you could eat junk food every day, and I guarantee you're gonna lose weight. There's no question about it. It's proven. It's because how much of junk food you eat.
Right.
So yes, you're gonna be skinny. You're gonna look good externally.
Right.
Because you're not eating enough calories, but internally, you're damaged. I guarantee that you're gonna be damaged. So how you shift that? How do you shift that from, hey, I'm skinny, but I'm healthy for sure, or I'm overweight and I'm unhealthy? Those are not true. Those two doesn't, being healthy and being skinny doesn't go together.
Got it.
Now, there's a good chance you might, because you're not eating a lot, maybe you're paying attention to what you eat. But if you're not paying attention to what you eat, then it doesn't matter. Yes, you look good, and externally, internally, there's a ticking bomb, right?
And I feel like that's what happened to me, by the way. I was just saying yesterday, I have rheumatoid arthritis, and I was having this conversation with somebody about my rheumatoid arthritis, and I was like, when I was young, because I was in sports most of my life, but I never ate great. I grew up, of course, in a Hispanic household, so it was always rice, beans, tortillas, anything you can make with tomato sauce, hamburger meat, and then, fast food, and I was thin most of my life.
You're getting me hungry now.
I was like, I can eat anything, and it was okay, but all the while, honestly, my joints have been bothering me since I was in high school. And when you're in high school, you wrap it and you go back out on the field, and it's no thing. Well, in my early 20s, I started having signs of my RA. And so now I think back and I'm like, maybe had I taken better care of my body when I was younger, but I didn't pay attention to any of that,
Yeah. So your body is extremely resilient. It takes so much time and so much damage that keeps on piling before it really shows symptoms. So it's not going to happen over a year or 2 or 3 or 4
Right.
unless you go
It's a
extreme.
process.
It's a process, and your body keeps on, the damages slowly build up, and then you see it. A good example is people who drink alcohol. I'm not talking about just normal drinking, alcoholic.
Right.
People who have 4 or more drinks per day. In
You hear that? 4 or more drinks per day, you guys.
That's an alcoholic.
That's an alcoholic.
Well, actually make it 3 or more. But you got to everybody function well.
Right.
So the liver takes so much of it. In 30 years, now you start
That's
seeing
when you're
the
going to
sign,
start. Yeah, absolutely.
because your liver is finally to a point that is not functioning. Now it doesn't happen with obviously everybody,
Right.
but we talk about
Right.
majority. So so there's no, your body doesn't go in 10 years to be like, oh my God, I have a liver cirrhosis or liver failure. It doesn't happen that fast, right? You just take it sweet time,
Right,
unless you're
absolutely.
drinking like a fish. And we have a lot of patients in the hospital that do. They're at 25, 30, 32, and they are already cirrhotic, means their liver is not working, and they're not going to live unless they're going to get a transplant.
Wow.
At age of 30, 35, that means they started at 15 or 16 years old, and they just went heavy and just went cruise through it. So your body, so one of the things we talked about acidic, now getting back to that. So it's what you put inside your body, and recent studies have shown that acidity is one of the main cause of the root cause of some of these diseases includes diabetes, hypertension, cardiovascular
and
disease,
cancer.
and
Right?
cancer.
And cancer.
Yeah, so so then you look at it and you say, why? I wasn't born like that.
Right.
But what happened through all this? So it's beside the food, obviously environmental factor, drugs and medication and alcohol, but then also majority of it is related to our diet.
Yeah.
And processed, sugary
Yeah.
food, canned food. I don't care what kind of canned food. Maybe recently has changed, but if whatever you pick that has sugar,
Yeah.
it's a preservative. It makes it taste good, right?
Right.
It is, they had a great documentary on that about the sugar. Everything.
Yeah,
Everything. Even
everything.
if they don't have it, they have a different name for it.
Right.
They have fancy names, the sucrose and glucose and lactose. So it's everything is sugar,
Right.
sugar. And processed food, we consume a lot of meat. We have shy away from fruits and vegetables, which is extremely important. So now we only consume a larger amount of food, a lot of calories, but we have a lot of that, plus we're eating bad.
Yeah.
So combination of that is a ticking bomb. This year, 45 million people started diet. 45 million people realized that they need to be on a diet to lose weight.
Wow.
That's a lot in 1 year.
Yeah. That is.
And that's because, once again, that becomes another fashion and fad, right?
Right.
$188 billion industry.
Wow.
So there's a lot that goes on to brainwash people.
Right. Well, like
Bring
you
it
were
to your
saying,
face.
there's so many different diets out there, but if people just, did the simple things right, and
So they asked me
eliminated-
what's the perfect diet.
Well, I know what your answer is.
Our answer is simple, right?
I already know your answer.
And your answer good. So
There
you have
is
listened.
no.
Well, there's no such a like as soon as you say the word diet means calorie reduction.
Right.
So we just have to establish that.
Yeah.
You're never gonna lose weight without calorie reduction.
Right.
So what kind of diet it is, that becomes a health issue. Now, once again, if you eat junk food, if you say, let's say you used to eat 3,000 calories, now you do 2,000, well, 1,000 calories or less, you're gonna lose weight.
Right. Exactly.
Whatever you eat. Now, if you do drop it and transform to a healthy choice, now you can see the difference and become healthy internally. There are tons of studies that show that people with certain diet, they do better.
Yeah.
They have less cancer, less heart attacks, less diabetes, less hypertension,
Everything.
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 And their immunity is better. Why? Because they are shifting toward an alkaline diet.
Alkaline diet.
So more of fruits and vegetables,
Right.
more fresh.
Right. Of
And
course.
we're staying away from sugary diet. So when I say there's no such a thing as a like perfect diet, because every individual is different. Your body is different. Your habits are different. Your desires are different. You can only sustain certain diet for so long, and then you gotta
Then
deviate.
you go back. Yeah.
Because if any of these diet work, people will jump on
Right.
board and they'll continue that. It doesn't matter which diet. So that's why I don't care about any of these diets, but I want to make sure that people understand that you gotta see what are you capable of doing for a long term. Not 6 months, you're gonna lose 20
It's
pounds.
more. I feel like it's more of, and I've said, breaking bad habits. So we're so accustomed to whatever we're accustomed to, and it's just. I think the thing that makes the most sense is like slowly bringing alternatives in, or just kind of like slowly taking your time to change things out and to eat healthier. And I think you realize once you kind of get used to that, then you get used to it, and then those cravings for those other things go away. My diet's completely changed,
Yep.
but I think that's because my body is craving certain things after and during the time that I was in the hospital. But I'm still trying to gain weight and having an issue with that. But I know in most cases people are trying to lose weight, and that's an issue. But again, I just think it's breaking bad habits, and we live on the Central Coast, and it's like everything is social here. So everything, it's let's go have a glass of wine, and well, let's have an appetizer, and then everything goes out the door, and it's like, and then you got the clam chowder, and you got it's like the bread bowls, and it's like the lifestyle here is just. It's amazing because we love to live here, but it's hard to not indulge in all of those great things. But I feel like more and more there's alternatives even on menus that are out there, and fish is a great alternative. And everybody has veggies, right? Just don't eat the bread. Save the bread for me. So
I think, I see, once again, I don't believe for sustainability part of it. There are very few people that could sustain the diet for the rest of their life.
right.
Just watch what you eat,
Right.
and how much of
And
it. Do you love
portion.
pizza? Go ahead, eat pizza.
Yeah.
Who's gonna say don't eat it? You love meat? Go ahead, eat meat. But not every day.
Yeah.
Maybe you're gonna have your meat. Okay, once a week, twice a week, maybe. Okay, no problem. You can't. You
Yeah.
want to have ice cream? Great. You want to have cake? Great. But just not every day. And just make sure if you have that piece, you gotta add some healthy, and then calculate your portions.
Yeah.
As soon as you do that, your body doesn't crave. So you have gained 100 pound or 80 pound or 60 pound, not overnight, not in a month, not 2 months. Took you a couple, 3-4 years. Now, for you to even mentally sit down and say, I'm gonna lose it in 6 months,
Not realistic, by the way.
not realistic in so many ways. Now, people can do it. Of course they can do it, right? They go through extreme diet, and
Yeah.
people don't realize how dangerous those extreme diets are. And so you go through extreme diet, you're gonna lose it, and then you're gonna gain it back. I guarantee you're gonna gain it back because you didn't do it the right way. Mentally, you didn't do it right. Your body, your mind
Yeah.
is not coordinating with each other. Your brain says, what the hell is going on, while you're pushing yourself
Yeah.
100 miles an hour, starving yourself to death. Now you have micro and macro nutrient deficiency that will hunt you back and causes so much more disease. One of the classic thing that we see is, infrequently, but we do see, is people who lose, a woman who wants to lose, 50, 60 pounds.
Yeah.
They come in with gallbladder issue because now they have formed stone because of the rapid weight loss, and now they have
Wow.
gallbladder issues. So it's just being an example of that. There's so many more examples of
Right.
nutritionally deficits. So that, just losing things in a short period of time is really not a good
The
choice
solution,
or
yeah.
not a solution, because once again your body is not used to it. So you're forcing your body to a style that is not used to it, it's foreign to it, and all of a sudden it has to adopt. But it does what it does because you're forcing it. But as soon as you let go,
Right.
and you cannot do that obviously forever, and it just slowly goes back to where it's happy.
Right.
So you have to shift the brain.
It's got to be a
happiness.
process. Yes,
Yep,
it's
a
a
process.
process, and it's changing your habits.
You're
really.
changing your habits.
And the older you get, the harder it gets. But that's definitely, I would say, after 30 years old, that's when you really got to start paying attention, because you feel like you're invincible when you're in your 20s and you can eat and do whatever you want, but it catches up to you.
And I think
it caught up to me.
And I think that's also a problem, that we don't realize that doesn't start when you're 30s or 20s. Problems start when you are 4 or 5, when you're born. What do you feed these kids? Has a long
macaroni and
lifeline.
cheese and
Macaroni
chicken nuggets.
Chicken nuggets, and parents have to feed. I have a 4-year-old.
Yes, you do.
I know what it is. She doesn't want to eat good things, so you try to incorporate and teach them what is the healthy way. Here's some fruits and vegetables. It's important. You keep on emphasizing that over and over and over and over until it becomes a habit for them to add it to it. And then there's a lot of studies were done that 12 years old already had coronary disease, right? That they have plugging of the arteries at 12 years old. So, and then obviously the rate of obesity at that age, the child is just significantly increased. We're heading. I know 35% is morbid, 35% obesity in this country, and the rate is going to 55 to 60%. So, I mean, it is extremely dangerous. One of the things is that acceptance from society of what is appropriate. Some of the places, being obese is the new style, the new fashion. So it's just crazy. So,
well, all we can do is sit here, educate people, and it's up to you to actually take action and do something about it. But we highly encourage you to, and same for my family. I mean, I pray that my family even pays closer attention to what they're consuming and putting in their bodies. And I know I'm always the person pressing them for take this product or eat right or whatnot. And mom don't want to hear it half the time.
Listen.
Mom, she's from that old school, Hispanic background, and she still wants to make her rice bean tortillas and menudo and enchiladas and it's I can't really eat a lot of that anymore. I'll indulge occasionally, but growing up, that was our lifestyle. That was that's all we knew. And so it's breaking bad habits, but you have to be willing to break bad habits and make that change. If you're not doing it for yourself, you're doing it for your kids, and you're going to live a longer life. That's what I try to tell my mom. I'm like, don't you want to, be around when, my grandson gets married? That's kind of how you look at it. So, but all you can do, again, is we can sit here and talk about it. But back to pH. So if I went to my primary and said, I want to get a pH test, would he look at me like I'm crazy, or
yes? So we don't. Okay. Yeah. So not as much as why, right?
Okay.
Because when you get sick in the hospital, say you have bad infection, what we call sepsis. So if we check your blood, the blood is become acidic.
And I did have sepsis at one point.
Right. Yeah, sepsis, and I'm pretty sure that pH was more acidic. So pH is a power of hydrogen scale. Basically, it's just a measurement tool for us to describe things. Start from 0 to 14, 7 being neutral. Anything above 7 is called alkaline. Anything below that is called an acid. Now, just keep in mind, our body is not neutral by any means of shape or form. Every part of the body, acidity is different. The stomach, for example, pH is 2 to 3. It's extremely acidic. Your skin is about 5 acidic. There's a reason for it, because tissues survive in a specific pH environment and do a good job. So blood is the one that's about 7.34 to 7.4, somewhere 3.5, somewhere there. It's a narrow range of what is normal, and that's more toward, if you break it down, it's more toward alkaline, and it does everything in its power to keep that blood at that pH, no matter how sick you get, to a point where your body now becomes really sick and it cannot adjust for those changes, and then you get really, really sick.
We're in downtown Pismo, if you can't
look
tell.
At that.
We have rap music in the background.
might have to start dancing.
You might have
now.
to start rapping.
Rapping, yeah. So I think that acidity, it plays an extreme role, not only in acute phase, but also in chronic inflammation due to acidity. Pre-diabetes due to acidity and more, also obesity. Obesity has predisposes you to having more acid in your body, and therefore it causes more problem down the road. So it doesn't matter how you look at it. This acid is affecting you. Now you go to your doctor, you're great. They check your blood pH is going to be that normal range. But once again, the key is normal range. Right. If you're 7.34, which is the normal beginning of the normal range, oh great, you're okay. But what if you are 7.33? Even though it's 0.03, it's a logarithmic scale. It means it's in a log scale. It's for everything is 10 times worse than what the number before. So those changes are incredible, and those changes frequently your body fluctuates. So when you eat acidic food, when you continuously putting junk food, that switches initially to an acidic, and then it does everything in its power, your kidneys, your bones, your lungs, to bring back the alkaline, to make it alkaline, to make it back to normal. So those shifting in that pH is where the problem really happens. And sometimes your body's in a chronic state, and those pHs in the low end toward acid, and then the damage is ongoing and continuing.
Wow. And so the good news is you can take care of your body, number one. There's a lot of things that we can be doing a better job of. But is there anything else that you would recommend or tell people out there that can help them outside of that, I guess?
So we live in a very fast-paced life. I mean, obviously we said there's no magical pill for you to say, hey, your body's gonna be alkaline and good, and just take this bottle and down and we're good. So it's just having healthier choice. Now, because we live in a fast-paced world, sometimes the role of supplement becomes prominent based on what you eat or what you don't eat. So one of those, supplements are high alkaline supplements that slowly help you through that transition. One of them being Balance 7. We work on Balance 7. I mean, part of that research, the company that does research and development. It's an extremely high alkaline pH solution that transforms your body slowly from an acidic to an alkaline environment. You just take very minimum amounts, one ounce of it 3 times a day to make those changes. But once again, that is not the only thing. It's not a solution,
though, right?
That's part of a solution.
You drink like 10 cans of soda, and then you drink this, and it makes it go away. That's not what we're saying.
So I think part of it is just transformation of you in a healthier way. Add fruits and vegetables, decrease your sugar intake, decrease your meat intake, stop eating junk food, processed food, and then these supplements will help you to regain that.
Exactly. And it has for me tremendously. I've come back big time.
Yeah, I've given it to a lot of patients. A lot of patients, and they have a significant difference in their overall health in a very short period of time. But once again, it comes with the education with that.
Exactly. And there is a lot of education. There's a lot more education, but I know we are limited on time. So I want to thank you for being here today. I know we've been trying to connect to do this, and now that I'm back almost 100%, very close to being 100%, so I can do more of this, and I'll be bringing you back on, and hopefully we'll get other topics. The one thing I want to mention for sure is that we're going to be doing an upcoming health seminar, and we're going to be bringing Lindsay Diaz in from Oak and Iron, and we also have a nutritionist. We did a health seminar, I want to say a couple months ago or so, and that was well attended in Santa Maria, and so we want to kind of keep this in the forefront, and I'll do my best in doing that. I know mental health is also a big topic for everybody, so we'll see what we can form around that and bring you an episode for that specifically. But there's just so much more that relates to our health, and I just encourage everybody to pay attention to their bodies. You certainly don't want to have to go through what I went through, and I have a whole new respect for doctors and everybody out there like Dr. Nooristani, and will be paying closer attention to my health, and I hope you do the same. So with that said, thank you for joining us on Everything Central Coast. All right, bye for now.
Thank you guys for having me.
Thank
Bye.
you.